सभी को नमस्कार। इस वक्त अभी हम लोग हैं कुन्नूर में और हम लोग पास्चर इंस्टीट्यूट ऑफ इंडिया जो कुन्नूर में है। ये इकलौता जो इंस्टीट्यूट है जो मोर देन 120 ईयर्स पुराना इंस्टीट्यूट है जो जिसको जो इसका इनका फंक्शनल है जो है वैक्सीन बनाना, मेनली वैक्सीन ऑफ रैबीज एंड डीपीटी वैक्सीनेशन। तो इसका फंक्शन के बारे में हम लोग इनका डायरेक्टर से हम लोग बात करना चाहेंगे और आगे मीटिंग में देखेंगे किस तरह का वैक्सीन है। और आपको जानना चाहिए कि जो रैबिस जो है पूरा इंडिया में एक तरह का आज का दिन में प्रॉब्लम क्रिएट हुआ है, क्योंकि छोटे छोटे बच्चों से लेके बहुत जन डॉग बाइट के पीछे रैबिस का शिकार हुआ है। इससे बहुत जन का जान भी गया है। तो इसके बारे में डिटेल ओवरव्यू उनसे बात करना चाहेंगे। तो हम उन्हीं से सुनते हैं कि किस तरह का रैबिस और का वैक्सीनेशन यहाँ बन रहा है और डीपीटी का वैक्सीन यहाँ में बन रहा है और यहाँ का फंक्शन और इनका अचीवमेंट के बारे में।
हर गहने में छुपी होती है एक कहानी और हर कहानी को बनाता है खास। श्री राजेश्वरी ज्वेलरी।
शादी हो, त्योहार हो, सालगिरह या कोई खास दिन, हमारा विश्वास श्री राजेश्वरी ज्वेलरी।
यहाँ मिलता है आपको शुद्ध हॉलमार्क गोल्ड ज्वेलरी का बेहतरीन कलेक्शन, क्वालिटी जो दिल जीत ले, डिजाइन जो नजरें थाम ले और भरोसा जो पीढ़ियों तक साथ निभाए। श्री राजेश्वरी ज्वेलरी, जहाँ हर खुशी का गहना आपका इंतजार कर रहा है। पता नियर शास्त्री रोड, एबरडीन बाजार, श्री विजयपुरम। कॉल 031922333822। श्री राजेश्वरी ज्वेलरी, आपके सपनों का गहना हर मौके के लिए।
Now these are the product profile and other allied activities of our institute. Our institute is mandate for the production of DPT, that is a triple antigen, diphtheria, pertussis and tetanus. Then TD, diphtheria, tetanus, toxoid for adults and adolescents, TT monovalent, tissue culture anti-rabies vaccine. See, currently we are not manufacturing TCRV since our facility is not GMP compliant. So we got 30 acres of land in Coimbatore. It's coming upcoming slides. So I'm just briefing it. There we are planning to produce TCRV with a new facility. Then other allied activities, rabies diagnostic lab and treatment center for general public. So previously this is the only institute having anti-rabies vaccine as well as the Sera. We get a lot of people from Karnataka, Kerala, Tamil Nadu for treatment. We are doing as a service. Then academic part of view, we are affiliated with Bharatiya University for MDs, for PhD in biotechnology, microbiology.
Look at the babies.
How many days? One day.
No.
Rabies has become a serious concern in our country. Although we are lucky because Andaman Nicobar Islands is one territory which is rabies free. But I want to ask you whether people are aware and taking rabies vaccines
That's gone. So now awareness has gone. Not like previous years. Last 2 or 3 years, we used to get many calls from the patients. They are asking so many questions. Even night also we used to get calls. So the awareness is becoming more now.
Is there some social stigma associated with vaccines here?
To add to sir's this thing, Pasteur Institute took a lot of efforts in making Nilgiris free.
Yeah.
Okay.
We achieved it also. But Goa was the
First state to achieve the rabies free.
Rabies free. The Nilgiris was also on the verge of it.
Okay.
Then the COVID came and things
Yes.
changed. But what we do, Pasteur Institute, since we were manufacturing TCRV for years,
Yes.
so we also on this Louis Pasteur's
Yes.
anniversary and birthdays, on September 28th, when the world observes World Rabies Day, we create awareness among people. We give speeches, we give lectures on how to prevent rabies, and we take a procession from here to bus stand, 3 kilometers walk. Then we give them two placards. And we distribute pamphlets. Now, what are the basic things you need to do when a dog bites? So those kind of awareness we create. And when we conduct also IVs also, industrial visits also. When many colleges come, they ask for some our experts to speak on rabies.
Yes.
So we go to educational institutes and we speak on rabies. Whenever there is an opportunity to talk about rabies, definitely we are doing as PA is known for rabies. So on that front, whatever awareness, we are always there. Every year we do this.
Along with, I would add a valuable point. Because of us, only the market trade has come down. We only introduced that
2001.
time 400 rupees, 500 rupees per dose. So we have only launched our product only 130 rupees per dose. So because of that, all private manufacturers forced
lower the
to
price.
bring down the product.
Okay.
So I would like to say PIC's contribution in coming down the bring down the cost of the vaccines.
That is the reason public sector should be there.
Yeah.
Yes.
If there is no vaccine from public sector, then what
Because
about the private?
we are working on no loss, no profit basis. Government is only going to fix the price under.
Yes.
So it should be there. Public sector should be there.
If for DPT vaccine, if we sell at 7 rupees or something, they sell at 70 rupees.
70 rupees.
Sir, I have two questions for you. First, on the HPV vaccination campaign that the government has started. So, what, based on your calculation, how much would be the entire campaigning, costing, and how effective it would be like?
Ma'am, it
Initially
needs
they
to
have
say
HPV
something.
is something
Yeah,
that's also
it's an
developed
experimental.
taboo.
Yeah. It's an it's an experimental basis they have started. It needs at least 1 or 2 years to assess the real quantity, how much is required. So at least 1 or 2 years is required to work out actual cost, actual quantity required, and how many volunteers are there, recipients are there. Minimum 1 or 2 years is required to do it. Already Ministry has given some direction for us to work with NAV Pune for manufacturing HPV vaccine and all.
And the second question for it is, recently in February this year, from Kasol, I believe, the tetanus vaccination that it was being...
TD vaccine, they have
Yes,
launched
it
the
has,
product, yeah.
converted to TD vaccine.
TD vaccine is
So if
launched.
you can explain, from TT to it is now TD vaccine that
Yeah.
has come up. So if you can explain what exactly it is and how it will be
Yes, ma'am.
helpful.
Actually, the TD vaccine concept came because of outbreaks of diphtheria throughout the world. Because of some breakage in the immunity and all, lot of outbreaks happened throughout the universe. Then WHO thought that why don't we go for TD? Because previously adults were not immunized with the diphtheria antigen. Then they thought of it. Then they worked on it. So they reduced the dosage because the dose what is given to kids, it may be reactive to us. That is the reason they have reduced the dosage level. Only 2 LF. Tetanus is the same. They have maintained it. So they started giving TD vaccines. Since now the pentavalent has come, DPT has come, no need of giving any TT vaccine monovalent alone. So that is the reason it was weaned out from the UIP program. So pregnant women are immunized with the pentavalent, DTP as well as the TD vaccine.
Initially, it was only in the childhood days, only when they were less than 2 years or 4 years, they finish it off with diphtheria.
Diphtheria.
Then diphtheria started re-emerging.
After the launch of HPV vaccine, we saw a coordinated campaign from USA, and these people were against the HPV vaccine, and they were saying that this vaccine is actually not good for health, and it actually spreads cervical cancer.
That is the reason I said it takes at least 2 years to assess the thing, because the vaccine is launched may be suitable for us or may not be suitable for other people. So once the clinical trials is going, people have to evaluate for all the different regions, and only the product has to come out. So exact picture will come to know within a year or two. Couple of years will come to
I
know.
think it was part of some propaganda against Bill.
That we can't comment it. We don't know.
But I think Merck is the company which manufactures HPV vaccine, Gardasil, I think.
To add on to his question, sir,
Merck is from
usually even during COVID pandemic happened and the COVID vaccination was there, a lot of population who were against it, against also getting the COVID vaccination. So what is
Usually Europeans, especially not in India. Europeans as well as Westerners, they will have always this type of things. One group will support, another group will against the vaccine part. So what I want to say is the idea is to give the pandemic vaccine to reduce down the mortality. Even though you can see the data, it is par with other diseases. The death every day is happening in the COVID. It's similar to other disease death. But here the choking of health system is very, very important, because at a time 1,000 people are coming, the hospital capacity is only 100, where they will go for 900 people. So the system will be collapsed. pandemic conditions. So they have evolved the vaccines to bring down the mortality and infection rate. So they have done it successfully. So all the vaccine, no vaccine is 100% guarantee that it is safe for the human. It is called idiosyncrasy. I may be good for it. So it may not be suitable for others also. So this is the right strategy what government took to effort to bring down the COVID death. Otherwise, no, the health system must have collapsed.
Sir, since you are experts in vaccine, I want to ask, do you have any update on whether somebody is working on HIV vaccine and what is the progress?
Lot of activities going on. I think a recent one article has come. They have successfully developed monoclonal antibody for HIV. This is the first time they are getting encouraging results. The antibody is able to neutralize the virus. So a lot of work is going on. Good progress is happening now. We'll see, sir.
But again, HIV, if you see, they are working from last 20-25 years.
See, the beauty of the virus, it used to mutate. For me, it's a different structure. But it's getting infected to somebody, it may have a different structure. Because of that reason, only unable to make the vaccine. So highly mutagenic in nature. That is the reason no vaccine has come up till now. But successfully, they have developed monoclonal antibodies to neutralize the different strains of virus. Yeah, similarly, malaria also. I think Bharat has launched successfully malarial vaccine is there now. People are making. See, now latest technologies are coming. What I want to say is tools are there. So automatically now we can, before going for proof of concept, we can develop in silico. That is, artificially we can make a vaccine and we can evolve it. Artificially we can simulate, we can test it, and it can be manufactured within a short period. So science has very good now phase is very good development is there to bring out the vaccine very easily. That's the reason COVID.
And so in animal inquiries there's a concern, leptospirosis, that is for animal fever.
Yeah.
The major concerns, especially after monsoon, a lot of people actually die from the disease. So is there a vaccine available for
People are developing, sir, because a lot of strains are there. Almost 7 or 8 strains are there. So once if a single strain is neutralizing different strains, no problem. Like rabies. Luckily, only I think 2 or 3 strains are available for commercial vaccine manufacturing. Leptospirosis, not less than 7 serotypes are available. So it's very difficult to make a vaccine which can neutralize all leptospirosis. A lot of research work is going on. So many, it's not a single step, sir. It's animal, it should neutralize all the antigens, and they have to go for clinical trials. Clinical trials phase 1, phase 2, phase 3. Then it will come for commercialization. Giving due respect to our animals. Without those animals, we can't test our vaccine quality cannot be determined. After completion of the test, we are making them to sleep. That is euthanasia. We are doing it. Plus, we are having the SOP to a human endpoint. For example, tetanus, we are giving highly painful toxin has to be challenged in the animal. It will have a lot of pain. Of a particular stage, once the particular stage arrives, the animal cannot go back to the normal condition. In that time, we are euthanizing, sacrificing the animal.
Classic example is DPT group.
DPT group of vaccines.
You cannot take away animals from the testing.
So that's the reason we can go for reducing the number of animals. It can be done. But it needs a lot of data to do it. Our target to achieve it, single dilution method is available. Once after commercial 30 batches of the data, we have minimum 30 batches of data. It should be there. Parallel, we have to test this method also, that method also. Then we have to submit the data to the regulators. Then they will give the approvals.
Now, since you mentioned about the in situ simulation,
Yeah.
with the AI coming into the picture, bioinformatics has, become
Bioinformatic tools, immunoinformatic tools, lot of it.
sensitive
Yes.
now. So, how are you integrating that in your institute? Do you use the AI?
Right now we are not doing it because already commercialized vaccines only we are planning to do it. In the future we would like to do it.
Thank you so much.
So, one matter for information about rabies, how dangerous it is, and as in a place like Andaman, administration, what kind of precautions should they take to avoid entry of rabies virus in Andaman Nicobar Island? First, you can give what is rabies, and then you can say that what administration can do.
Rabies is a viral disease. All warm-blooded animals are susceptible for this disease. Mainly through saliva. The virus is transmitted through saliva, mainly through saliva. Then main reservoir is what I want to say wild animals like bats, raccoons, and abroad. So different regions, different animals are there, like foxes, wolf. So basically, the main transmission route is through dog bite. dog as well as the cats. So, in case if you want to prevent Andaman, whoever is bringing the animals like dogs, pets, ensure that whether the animals are vaccinated and having enough titer to protect them from rabies. So they have to furnish the certificate from a reputed institute. By checking that certificate only, you should permit them to bring their pet animals.
Sir, if somebody suffers a dog bite, how much long it can go? Like what kind of like suffering a patient can undergo? Like what will happen ultimately?
As I said, prevention is better than cure. As soon as the dog bite is happening, they should wash the wound with plenty of water. They may apply some antiseptic lotion. Immediately they have to rush to the hospital, and they have to, based on the bite, they have to go for vaccine.
Okay. Or else what wrong can go? Like or else
No, this is
what
mandate.
can happen to the patient if there's a dog bite and it has rabies?
For example, it's a neurotrophic virus. It will enter into the nervous system. It will, through nervous system, it will travel to central brain. It will reach the brain. That started multiplying. It will damage your neural tissue. Once again, it comes from the centripetal. Then all the saliva, everything will be full of virus. Once the CNS system is involved, there is no chance of getting survival. No cure for this.
Thank you, sir.